Well, the Council for Scientific and Industrial Research has warned that more COVID-19 patients are dying now compared to the first wave. For more on this, we're joined by the CSIR senior researcher, Dr. Ridhwaan Suliman. Thank you so much, Doctor, for joining us. Just how dire is the situation and why is the mortality rate higher?
Good morning, Annika. Unfortunately, following a large increase and surge in the number of COVID-19 infections that we have been seeing over the last few weeks, particularly in Gauteng, but across the country, we're now seeing that's translating into an increased burden in hospitals, more people being hospitalized, and sadly now a significant increase in the number of deaths that are being reported. So nationally, over the past week, we've reported over 2,300 deaths across the country, an average of 337 per day. Concerningly, that figure is on the rise, having increased by 100% compared to the previous week, or in other words, reported deaths have doubled in the last week. Unfortunately, 45% of those deaths are within the province of Gauteng. We know Gauteng has been the epicenter of the third wave, where infection rates have been incredibly high, more than 2 times higher than previous peaks. And unfortunately, the number of deaths in Gauteng on average over 140 per day and doubled in the last 6 days. So just following the surge in infections, we're now seeing a significant rise in hospitalizations and deaths.
Why is that, Doctor? Is it perhaps because more people are sick this time around?
Indeed, Annika, we are dealing with the Delta variant that is more dominant during this third wave. We do know that based on studies coming out of the UK, this variant is highly transmissible, and estimates are that it's twice as transmissible as previous variants that were dominant. And so there's certainly a lot more people being infected with COVID-19, and we're seeing, if we look at the 7-day average of national reported cases, it's now at 19,500 per day, at the highest point that we're seeing since the start of the epidemic, having surpassed the previous peaks. The good news, though, is that there is some possible slight signs of a slowdown within Gauteng. However, there's still a significant increase in the neighboring provinces of Gauteng, as well as the other 3 big provinces along the coast. And so those increase in infections is just translating into more people requiring hospitalization, and sadly, a proportion of those succumbing to the virus.
Quick last question. Have you been able to find out what people are actually dying from? I know they're COVID-related complications, but what is the dominant cause of death?
Unfortunately, we haven't really been tracking the specific comorbidities or so. I think the NICD is better placed to track that. So we're just looking more at what is reported and the trends nationally and provincially. So I'm unable to answer that specific question.
All right. That was CSIR senior researcher Dr. Ridhwaan Suliman. Thank you for your time.